Some bowel that's stuck up in there is being pinched
Oh, my
off. So
goodness.
what we need to do is open along that area and push everything back inside and then pull things together, and we'll probably wind up putting some mesh in there to try to hold everything together. Now you've had a hernia repair before.
Yeah,
Yes.
Belly button, same general area.
Yes.
Did they use mesh?
yeah.
Yes.
Okay.
And then they had to go around, he's got peripheral artery disease.
Uh-huh.
So
You've got
they
a
had to
thumb
cut-
bypass.
They
And,
had to cut into that
oh, okay.
when they went and done that part. But
Did they
yeah.
do a, did they go into the groins with the aortic bypass? And
Yes, yes, you know, your main aorta,
Uh-huh.
they cut into that and had to put an artificial.
Right.
And
And then
they-
they put another one from groin to groin.
They did,
Was that
they
the
did.
same time or a different time?
different time.
Okay. How long ago was the surgery for the aorta?
Lord, 10 years?
5, 6, something like
Okay.
It's been a while.
Okay.
I'd have to go home and see if I could find the
Now, have you
dates
ever
on it.
had a heart attack or? Do you have emphysema or COPD or problems with your breathing?
that. Not yet.
Okay. Now, and you smoke a little bit.
Sometimes
How much do you smoke on an average basis? Would you say?
we just wait a week,
Yeah, maybe a week or a month or something.
5 or 6.
Okay.
Yeah, I'd like to hear that myself.
And you've had, how long have you had this hernia, do you think?
A while,
Several years?
yes.
Yeah.
yes.
Okay. Has it
It's
been getting
being
larger?
fixed. Yes.
It was getting larger?
It started out with one, and I think he's got more than one.
He's got one here and he's got a smaller one up here.
Antozano, do you know
Yeah.
him?
Who?
Dr. Antozano,
I
is that
don't.
his name? He was here at the time, but
Uh-huh.
he kept saying he was going to have this fixed.
Right.
We knew that, but
Right.
you put fires out one at a time sometimes. I've been
Okay.
ill
He
for a
was
while.
South Charlotte.
Okay.
He was coming. Well, he got surgery over here.
Say that's too big.
Now, before today, was this going back inside or is it always stuck on the outside?
No, he'd push it in.
You push it in?
He pushed it in himself. He would have
Okay.
gangster something on
See.
it.
Good.
And I guess he got scared yesterday because it wouldn't go back in.
Okay.
And then it come up this, what you see,
Uh-huh.
and that wasn't going back in.
Right.
But he's had a lot of gas,
Uh-huh.
you know.
Have you been passing gas from below?
No,
Any bowel movements?
not
No.
today.
Okay. When's the last time you passed some gas? Do you recall, Mr. Briggs?
Anyway, burp.
No, from below.
Well, I guess I have today, but I don't.
Okay.
know.
I
Bigger
would care.
thing.
That's how much
What's
he's
on
had
it?
total out, sir, from his stomach.
Okay. Okay. Great. Thank you.
I've got some papers I was supposed to give you too, from his regular Dr. Edel. That's who
Okay.
we went to this morning.
Oh, okay.
And then he sent us up.
Sent him to the,
He sent
okay,
us up
sure.
because he knew that he had a blockage
Sure.
somehow.
Sure. When's the last time you had anything to eat or drink?
Yesterday morning. right?
Okay. Have you had nausea and vomiting?
Yeah.
Okay. Been throwing up or just
Last
nausea?
night.
Last night. Okay. And then the pain, is it staying in the same place or has it been moving around or
Going
going
back to.
into your back?
Yeah.
Okay.
Fella can make some money.
It's not so little anymore.
I don't want to eat or drink. Seems like I just take a drink of a level of water. It just-
Uh-huh. Makes you more bloated? Well, what we're going to have to do is make a decision through your old scar here and take a look at that bowel and see if it's still good or not. If there's some bowel that's bad in there, we'll have to remove that and put things back together. And then we'll push everything back inside and see what we need to do to get that fixed. Sometimes we have to put some mesh in there, kind of like what you did when you had your belly button fixed. There's another separate little hernia up a little higher, but they're all kind of together. So we'll see if we can't get both of those at the same time.
Nothing over here.
No, sir, everything's on that right side.
Okay.
Even under the best circumstances, doing the best job and everything, there's always a chance the hernia can come back. So, but we'll try to fix it the best way we can, and hopefully it'll stay fixed. There's risk for bleeding or infection, no increased risk for infection with mesh, you know, with
Did you
this,
say no increase?
no increased risk of
Okay.
infection with the mesh.
Okay.
It's possible, depending on how you do during the course of surgery, that you may have to stay intubated overnight on the breathing machine, but we'll keep you real comfortable if that has to pass. Otherwise, we'll wake you up and get you to the floor. You'll have to keep the NG tube in the nose until things start passing through, and we'll put a catheter in your bladder if you don't already have one, so that you can kind of keep an eye on your urine. And then we'll work on managing your pain.
This is
after
a serious operation,
Cyber
isn't it?
seal too, about 5 or 6 weeks ago.
I'm sorry, what?
A cyber seal.
A hydrocele?
Yeah,
Okay.
it ain't completely lubricated yet.
Okay. Well, that's all right. That won't cause a problem. Let me take a listen to you.
Hydrocele, that's what a cyber.
What will you do
seal
with
is.
the part of the colon?
Well, it looks like it's small bowel, but since it's been pinched in there, sometimes I'll cut off the blood supply and it'll be bad. And if we leave it behind, it'll rupture, and then he'll be back in surgery. So if it looks bad or there's any question at all about whether it's good or not, I'll take it out and I'll hook things back together.
Okay. That's no big deal.
Well, it's still
It's a deal.
part of a big surgery,
I
and
know.
any cuts we make in the bowel, and anytime we put things back together, there's always a risk that something could leak or fall apart, requiring more surgery. So
Okay.
I'm certainly hopeful that's not going to be the case. Hopefully we'll see is that something stuck in there. Once we free it up, it'll pink up and look normal again, and then we'll just fix the hernia like we ordinarily would.
Okay. Okay. Sounds good. We'll hope for that.
All right, so take some deep breaths for me. Good. And once again, okay, and just breathe normally. And that belly button hernia was fixed before your aorta was fixed or after? Before.
The side here,
Uh-huh.
is about a year or so into that place. Both sides blood clot.
Oh, from the main,
Yeah.
so they had to do that bypass?
No, he already had it. What he done, he went outside and cut grass in the summertime, didn't
Uh-huh.
drink. Got dehydrated, he's got thick blood anyhow. Clogged both sides of that thing.
Okay, so go in there and pull all the clot out?
Daddy, we got up here and they were already preparing him to do the operating room, because they'd never seen both sides
Right.
clogged up like that.
Did so that was the first. Both sides were clogged.
Well, I hate for you to be the first in anything, but we'll get you all fixed up. Any questions at all?
Something he was complaining about earlier. He would like to be the next person in this hospital to get a pain pill.
Well, we are going to have more pain medicine than you can imagine upstairs, so they're getting
Oh,
ready
okay.
for you.
Oh, really?
As soon
Okay,
as
good.
we're ready down here, you'll go upstairs, so we'll get you some good pain
Do you
medicine.
need this? You can look at it and see if you do. If you don't, you don't.
Yeah, it's his history and stuff.
I think.
Yeah. Well, that's always
You
good
just
to
said to
have.
hand it to the doctor.
Sure. Well, I'll tell you, I'll hold on to this, take a look at it, and I'll give it back to you when I'm finished with it, okay? That's good. That's always nice to have.
Okay.
All right, any other questions? Okay, let's see what we can do to get you going. The sooner we get you fixed, the sooner you're getting well, right?
It hurt though.
Yeah, we're going to fix that upstairs. You drift off to sleep, wake up, everything will be all finished.